Hi, this is Tim Ashe. I'm the president of the Vermont Senate, and as I've been doing in recent days, I'll be hosting a daily live stream to try and provide the most up-to-date information about what's going on in Vermont's efforts to fight the COVID-19 virus. Clearly, we are in unprecedented times, both in terms of what government is being required to pull off, but also the disruption it's having in people's lives throughout the state. Today, I went to the grocery store, and there's going to be a term we're going to be hearing in a few seconds when I talk about childcare, the term essential personnel. And oftentimes when we think of essential personnel, we think of police, firefighters, emergency responders, healthcare workers, and that title certainly is true of all of them. But I also really reflected today about how easy it is to take for granted the work that's done by people in jobs that don't receive as much public recognition. And at the supermarket today, I've started to realize as we continue to close down normal activities of the state to prevent this virus from spreading, we will be expecting most supermarkets, grocery stores, small markets to be open, or at least allowing them. And the people who work there are clearly essential, even though in general we don't think of them that way as a society. And I want to begin by recognizing the fact that the people who show up every day and work in our food service sector, at our grocery stores, they might not have high-paying jobs, they might not get all the fanfare and glamour that other professions do, but now more than ever we realize how very essential they actually are. I also want to begin by saying that we have so many people throughout this state right now who are at the front lines of fighting this crisis, and many of them are out of our sight right now as we narrow our daily activities. People who work in group homes for older Vermonters or the disabled, people with disabilities, people who are working in our healthcare sector in all across the state, people who work in mental health services, police, fire, emergency rescue, teachers, childcare workers. All of these people are at the front lines confronting greater risk than others in our state, and I think we all owe them a debt of gratitude. And it's hard to say thank you to each one individually, and I think we all make a collective thank you to their efforts. I'm going to provide several updates today based on information that's been coming in. I'd like to begin by saying that this has been an extraordinary flood of information coming to individual legislators and also to the administration. And so one of the things I beg at this point on behalf of my colleagues in the Senate and the House is be more patient than you might normally be in terms of our ability to communicate back. Many people don't appreciate that legislators don't have staff, so we're doing our own communication at all times, and in this moment where there's so much going on and so many floods of communications, we're doing the best we can to be as responsive as possible. So the first thing I want to acknowledge is that under normal circumstances, we will have from time to time a small number of businesses that may be laying off workers on a given moment. And bear in mind, we've had one of the 2 or 3 lowest unemployment ratings in the country for a number of years. Right now, we have just observed, and with the action to shut all bars and restaurants, thousands and thousands of people throughout the state in one day became unemployed. Our staff to take in these calls is normally fairly limited. Obviously, these are not normal times, and so many people who have been encouraged to call the state unemployment insurance hotline have been doing so and flooding the system. So there is going to be a need to be somewhat patient while the state switches its system to accommodate more people who are calling in to sign up for the benefits. I do want to make a quick break. One of you has commented, and I should have highlighted this from the beginning. Our janitors and custodial staff, not just in schools, but in all workplace settings. Obviously, another position that it's easy to treat them like they're invisible. They do their work often at night when we're not there, but without them, this virus would be much more able to spread. So thank you so much to them for their efforts. What we hope is going to happen in the coming days. The Department of Labor has expanded the number of people who are taking calls from both employers and employees who are trying to navigate the new frontier on unemployment insurance. So expect in the coming days a surge of staff to take in those calls. We are also encouraging the Department of Labor to try to adopt an online enrollment system, which would not be the way we do it normally, but this is a moment where it is not reasonable to expect that people sitting at the phones are going to be able to take in this massive rush. So I'm very hopeful that we will see an expansion of the options for enrolling in unemployment insurance in the days ahead, and you should look forward to seeing that. If it hasn't already happened, within a matter of minutes, while I'm on live at approximately 5:35 right now, the governor will be issuing new guidance on the childcare situation. Legislative leaders, myself, the Speaker of the House, and others were on a phone call at 4 o'clock where Commissioner Schatz, the Commissioner of the Department of Children and Families, gave us a preview of what the governor's new order would include. I don't have all the details at this time, nor did the commissioner, but I can touch on a few high points. And for all of you who are either child care providers, owners of child care facilities, operators of child care facilities, or parents who would be affected by this, I ask you to both listen to the big thematic things I'm about to say, and then stay tuned for the more specific detail that we'll see hopefully in the governor's order. The first piece is that the governor is going to order the closure of all child care facilities except those serving what are called essential personnel. Now, we know partly what essential personnel is meant to capture: people who are working in healthcare, people who are working in first responders, people who are obligated to work protecting the elderly or vulnerable populations. We asked the commissioner if there was an exhaustive list of what was meant by essential personnel. The commissioner acknowledges that while they came forward with a group of professions for which this would apply, there will likely be others who weren't and didn't fit the definition when they created it. So, if someone, for instance, is working at COTS, which is near my house, they have a day station that serves people who are homeless or at risk of being homeless, I would call that essential personnel, meaning that their children should be in childcare if need be. I don't know whether the guidance will be that specific. So, for all the parents out there and the child care providers, when you see the guidance, really spend some time to see how it will impact you, and then I very much welcome receiving your feedback about how we can tailor the governor's executive order differently to better meet your needs. So again, the governor is, within a matter of minutes, going to order the closure of all child care facilities except those serving essential personnel. There will be other details forthcoming. I'm here reporting what we know is going to come in an executive order. With that order will also be limitations on the size of any one particular setting to less than 10. There will also be a prohibition on any group activities at these child care facilities. So, in the coming day, there will be more guidance from the governor's office, and the Department of Children and Families, who are overseeing this response on the child care front, have acknowledged that there is going to be a great amount of work to do in the next couple days to get all the details right. They anticipate having to make direct contact with not just hundreds, but possibly thousands of child care providers throughout the state in just the next couple days. So this is not going to be a seamless transition in the next couple days. And I know that for many of you, it's easy for me to say that we hope you'll be patient because your lives can't stop on a dime in order to accommodate this. But what we need to hear, those of us who are in the legislature, we aren't controlling the levers of the executive orders, but one important role we play right now is hearing from you about what could be done to make this work better. So you should be emailing me, your local legislator, tell them specifically what you think should change in order to better meet your needs. I want to give a quick recognition to the Peace and Justice Center. They are not the only ones doing this, but many people have said that they would like to find a way to help out. There are people now who are home from work, some who are not working at all, some who have extra time now that they're working remotely. Many people want to be able to contribute their efforts and resources to help those who need extra assistance in these difficult times. The Peace and Justice Center website has a clearinghouse of what are being called mutual aid organizations. All across the state, community members have been coming together to develop lists of needs of some people in the community and also resources people have to offer. So if you go to the Peace and Justice Center's website, you will see a list of mutual aid organizations that have popped up like wildfire all over the state. I have to acknowledge that these are not state sanctioned. The state is not getting in the way. So when you're participating in one of these mutual aid efforts, be mindful that in some cases the best thing you can do for your neighbors is to stay home despite your desire to help out. So please be thoughtful about how you interact with individuals in the community. Another update, and this is thanks frankly to many calls and communications we've been receiving by those who have medical needs that require prescription drug refills. We just learned that the administration is going to has issued an order requiring that all pharmacies provide 30 or more day refills for people who have medical needs. There were some who were going into the facilities and not being able to provide longer term refills, and as a result it meant that people had to come into more and more contact with people who might put them at risk. So this is good news. Also good news is that the sun's coming out, although you'll notice that it's now blasting me, so let me do a little redirect here in real time. And I'll try to, it looks like a film noir scene now. Also, we have as we know, we have so many questions coming in from so many people throughout the state, calling different agencies of state government, not sure quite what the response ought to be to specific questions that they have. And all of the state-run AmeriCorps staff people have now been directed to the state's 211 program so that there is a surge capacity, if you will, of people who are able to be fielding calls from throughout the state. And I want to thank all the AmeriCorps people. Trust me, they do not do the work they do to get rich. They're doing it because they believe in public service, and now is a time when we need them more than ever. We also know that all of the utilities in the state, I believe all, definitely all of the major utilities, have announced that they will not make any discontinuations of service for failure to pay while we are in a state of emergency. Many of us in the legislature are encouraging even more strong protections of people in these difficult times, which could include prohibiting any evictions at this moment or any foreclosures. We expect Vermont-based banks, Vermont-based credit unions to be working with us to make sure that people don't suffer because they can't make their normal income to meet their basic needs. We also spoke today with the Director of Emergency Management, Erica Bornman, and also the Commissioner of Public Safety, Mike Sherling. They jointly are, Erica Bornman runs the Emergency Operations Center. The Emergency Operations Center is in charge of managing all of what's being worked on throughout the state in terms of meeting people's food needs, supply needs, health needs, and so on. We asked them what some of the most important planning operations they have in place right now, and I'll briefly say they are being very mindful of the supply chain for commodity foods. Right now, supermarkets and grocery stores, although you wouldn't really know it if you walked into one, they are actually still receiving supplies. It's just that people are buying them so fast that the shelves for many products are increasingly empty or nearly empty. So they are trying to monitor that because if need be, they can put in place a commodity distribution network to make sure people get their basic nutritional needs met. I'll pause there just for a moment to tell you to reflect on that. The crisis is so bad and could get worse that we may need to have a food distribution program to make sure people's basic needs are met. And I'm not talking a replacement for the school meals program, which is very vital for young kids, but one that might meet a broader section of society's food and nutritional needs. That's how significant it is. The Commissioner of Public Safety also says that they are in active planning to make sure there's medical surge capacity. Anybody who's seen images from other countries where they were not prepared, they see hallways of hospitals with people stuffed all over the place without appropriate medical resources. Right now, the state is planning for what will happen if there are so many demands on the hospitals that the normal bed space is inadequate. Also to that end, University of Vermont Medical Center, and I now believe, if not all the hospitals, most of the hospitals have already suspended elective surgeries because they want those beds to be open and the space open and the personnel available to deal with the surge of cases that we anticipate having. It still feels like we're in alternate realities right now. And on the one hand, we walk outside, the birds are still flying, people are riding bikes, and it's hard to really see what looks like a sleeping tiger, so to speak. But we know from all of the other countries that where we are on the curve is likely to not stay that way, and we are going to see a spike in cases. And so the imposition that it might feel like on an individual basis to have an elective medical procedure delayed has to be put in the context of the greater collective good, something that many of us are appreciating much more today than we've ever appreciated before. I want to make sure that people know that every day at 4 o'clock, a combination of Senate and House leaders are meeting by phone to discuss the most critical things that have been going on in the state at the time. Each day we have an agency official or someone helping to run the state's response. This has been helpful for the legislature so that we get a real-time read, not only of what's happening so we can communicate out, but so that we can provide the kind of advice to help them do their job even better. So you're all welcome to do that. If you go to the Joint Rules Committee webpage on the legislative webpage, each day it will tell you what topics we'll be talking about, what time, and how to call in. We've had hundreds of Vermonters listening in to our deliberations. It gives you a very good insight into the challenges facing our state officials and will help you understand how to communicate with legislators how we can better meet the needs of the people of the state. You also, I will really strongly encourage people to email me or other legislators specific questions you may have. As I say, we have been inundated with questions from around the state asking about unique situations, whether it's a business or someone who's out of work or having their hours reduced, teachers, parents, people across the board have been calling us and emailing us with questions. And while we can't always respond in real time, those have been essential to meeting people's needs in the meantime. A couple small examples. After my daily update yesterday, I received a number of questions from health services providers, including physical therapists and mental health practitioners. As a result of those calls, we were able to contact the state healthcare director, work with insurers, and get the process moving so that those services that are normally done in person could be done remotely, but not put the provider out of business at the same time. So those calls we received were absolutely critical to making more of the people providing needed services, critical services, able to do so in a safe manner. So I really want to compliment those who've reached out. We also know from emails coming in the last couple days as a result of these videos that we need to transition the way we think about volunteer drivers. Many of the people who deliver Meals on Wheels and other important services are of retirement age, and we are asking our transit agencies to step back and make sure we're not putting more people into harm by driving around to a number of settings. That will require accommodations and finding other people, if need be, to take over the particular routes or the particular services. So keep your emails coming, and we will make sure that we take real action as a result. I expect that on tomorrow's call, I'll have more updates on the childcare guidance that is coming out from the governor's office imminently. I also want to encourage, and this is something we've been hearing from around the state, that There are people who are hoarding needed supplies, whether it's cleaning supplies, toilet paper, paper towels, wipes, and so on. I can't say that I ever anticipated I'd be talking about this in my role as a senator, but one of the things that's happening is if you go to a supermarket, you'll see many of these things are not on the shelves. This is not a surprise to all of you who've been out shopping. The key thing to think about when you're grabbing however many things you are of Purell or toilet paper or you name it is if I take 5, that might mean someone else doesn't get 1. So now more than ever, we really need to be thinking about this as a collective action to keep people safe. And I think that's something that we all have to keep taking a step back, reflecting on, and making sure we're being as conscientious as possible. So I'll close where I began by really saying how many people right now are at the front lines of this crisis, how grateful I am and how grateful I know the Senate is and the House to meeting the needs of people in these very difficult times. I also want to say that I have been in consistent communication with the governor and members of his team, and I know that, as I say, looking back, we'll say, oh, well, maybe they should have done this thing differently or that thing differently, but right now they are 24/7 trying to do the right thing to keep people safe every single decision they make. And so we're facing an unusual situation where normally when a state policy occurs, we think, how does this affect me? And of course, we naturally respond that way. How does it affect me? How does it affect my family member? How does it affect my family and friends? But this is an extraordinary occasion where the first question may be that, but then we have to put right next to it, how does this affect everybody else? And at the end of the day, keeping the most people safe and alive is the ultimate bottom line, and the thing that is our ultimate barometer of what we're doing is the right thing. So I want to thank you for joining in. I'll be back at 5:30 tomorrow with additional details of tomorrow's information that comes in, and also remind you, feel free to email or post questions so that we can be as responsive as possible. So hope you'll all keep taking individual and group actions to keep people safe, and I'll talk to you tomorrow.